Arthritis wants movement. Movement is the key. Movement is helpful for that joint to help reduce the symptoms in the joint.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
Welcome back to the Motion Lab podcast. My name's Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopedic Group. I'm here with Darren.
Hi, my name's Darren. I'm the lead physical therapist at Colorado Springs Orthopedic Group.
So today we thought we would talk about arthritis. Arthritis is probably one of the biggest complaints that we get in an orthopedic office. We have a lot of patients that are aging and develop arthritis, whether it be post-traumatic or just osteoarthritis, just from wear and tear of the joints. And we get a lot of questions regarding arthritis and can I still be active? What can I do to help reduce the pain from arthritis? And am I still allowed to participate in my outdoor activities, and that type of stuff. So we thought it'd be good to discuss that today. So Darren, from your standpoint, arthritis-wise, what do you see in the physical therapy clinic?
So arthritis is affecting multiple joints,
Yep.
and it's not, just one versus the other. It's generally kind of spread throughout the body.
Yep.
So predominantly what we see is knee, hip, shoulder. Well, you can get arthritis in the spine, the ankle. Really any joint can be affected by that.
Yeah. I think the weight-bearing joints are obviously affected more commonly. So as you said, ankle, knee, hip, because they get a lot of the stress with everyday life activities. And then the non-weight-bearing joints can be affected as well. Different types of arthritis, which we maybe won't completely go into, but osteoarthritis affects multiple joints. Sometimes if you have a previous injury to an area, you can have post-traumatic arthritis, and that can just affect a single joint. I think the big thing I always try to get across when somebody comes in complaining of pain from arthritis, whether it be this constant dull aching pain, is that arthritis wants movement. Movement is the key. Movement is helpful for that joint to help reduce the symptoms in the joint. I think there's good literature out there that shows a low impact exercise program can significantly help any type of pain with arthritis. What are your typical recommendations when people come in with arthritic type pain?
Low impact's going to help lubricate the joints.
Yep.
Get some fluid in there. It's going to help decrease some of that grinding on those joints. Allow you for a little bit better mechanics with the movement, a little less pain, hopefully.
Yeah.
Long term, we can't fix the arthritis in the joint, but if we can kind of lubricate that joint a little bit, build some strength around the muscle, hopefully we can give some relief.
Motion allows, as he said, for your body to naturally bring healing cytokines and different types of anti-inflammatory properties to the area. I think heat works better than ice because, again, heat provides a vasodilation, which brings increased blood flow to the area, which helps to reduce a lot of the symptoms. And so I think that's where the motion can be helpful. And even for just acute, injuries, most acute injuries like low back type pain, you want motion with that. I think one of the biggest questions I get as well is, we live in Colorado. People love to do outdoor activities. They love to be active. And they always wonder, what can I do if I have arthritis? So let's say I have arthritis in one of my weight-bearing joints. Can I still participate in the activities I love to do? What's your typical answer regarding that?
I always like to say yes.
Yeah.
Yes to everything.
Yes.
And we'll deal with the consequences after.
Yeah.
What's the point of trying to get something fixed if you can't go out and enjoy the things you want to do?
Correct.
So it's kind of a loaded question.
Yeah.
A loaded answer to your question.
Yeah.
But yes, I want people to be able to participate in their activities. So we just have to find ways to allow them to do that. Yeah. And I think, again, we've talked about it before, warming up that joint. Like you said, heat's better. You can do something like go to a sauna or sit in a hot tub, or you can warm it up better with a gentle bike ride, stationary bike, some light walking. I know they have walking programs at the mall here for days like this when it's snowing outside. And you can go get some light, easy exercise indoors where it's nice and warm. And then you can also do something like pool therapy if you have access to a pool, just to get out, move a little bit. Helps warm the tissues up, get those joints moving a little bit more. Yeah,
I think that's the big thing is we never want to take activities away from people because people use activities for multiple reasons, for physical fitness and for health, for reduction on comorbidities, high blood pressure, diabetes, and things like that. We have to stay active, keep our weight low. And then, the mental component of it, just for stress relief. And so our goal is always to allow you to participate in the activities you love to do, but sometimes we maybe have to modify those. One of the big questions is, can I go run if I have arthritis in my knees, ankles, and hips? And the answer is probably yes, you can run. I think high level and long distance running may participate into the progression of your arthritis. So we may have to modify, decrease your mileage, modify your footwear for softer footwear, maybe run on less hard surfaces. So more trail running than road running, because that reduces the stress on the joints. And maybe cross train a little bit, run once a week, but then do lower impact exercises, the bicycle, the elliptical, the rowing, the water aerobics, swimming type stuff, the other days of the week, to still get that exercise component of it, but not as much stress on the joints. So I think that's a big thing that we like to kind of get across to patients is, yes, we want you to be able to do the things you love to do, but sometimes we have to make some slight modifications to those. As you said, and I think stabilization of the joints can be quite helpful. There's a lot of good literature that shows if we improve the neuromuscular firing, your ability of your mind to tell your muscles to fire, and we improve the strength around the joint, it can unload that joint, take some of the pressure off of the joint. If the muscles around the joint are weak, we put a lot of pain onto those joints and those bony surfaces, which can cause increased arthritic pain. And that's where the low impact exercise can be helpful.
Yeah, we like to work on a spectrum. Yep. We want stability, but also mobility.
Yep.
So if the muscles are too tight around the joint, we're going to get more compressive forces on that joint.
Yep.
So if you can picture kind of a knee, if you want to grab that model there, we can see if that'll help a little bit. So the quad's going to sit on the front,
yep,
hamstring on the back of that knee.
Mm-hmm.
If these are both tight, we're going to get more compression onto that knee joint.
Yeah.
So doing something gentle like stretching out to quads, stretching out to hamstrings, will unweight that joint just a little bit and decrease that compression. Some of those bony points won't be as irritating.
Yeah. And then one of the questions we get, because, in the express care clinic or the kind of walk-in orthopedic urgent care, I see a lot of acute complaints of arthritis. And a common thing is, well, I've never had pain in that joint before. And arthritis is a progressive condition that happens over years, not over days. And a lot of the times these joints can be quiescent. They can be quite non-painful, because we all have this ability to tolerate some level of pain that's just an everyday ache and pain. And when it progresses beyond that level of tolerance, that's when it becomes more symptomatic to us. And so sometimes we'll provide some modalities to calm the acute inflammatory symptoms down, and then we'll have them see Darren and his physical therapist to provide more long-term relief. So we can do joint injections, we can do medications, topical or oral medications, and those can calm things down to allow them to participate with you guys a little bit more comfortably from a therapy standpoint.
And we can also provide stuff like dry needling.
Yep.
We have traction, ultrasound modalities. We have A-stim techniques that we can use to kind of further help calm tissues down in order to try to rebuild around that joint.
Yeah, and I think you would agree, some of the low back conditions, some of the cervical spine conditions, some of the acute inflammatory conditions can also be helped with your modalities as far as physical therapy. And so that's why, I think there's two components or two aspects of therapy, which we've talked about. The acute inflammatory aspect, hey, the first few visits, we're going to calm things down. And then the next few visits after things are calmed down, we're going to try to provide stabilization to provide more long-term relief.
Yeah, you kind of touched on it when you said arthritis doesn't just boom, pop like that.
Yeah.
It kind of builds months, years.
Mm-hmm.
So people come in, they'll have an x-ray, says, oh, I got, degenerative disc disease in the back or arthritis in the knee.
Yeah.
But there was one instance where their pain came on.
Correct.
So it's not necessarily that arthritis caused their pain at that point. They could have irritated that joint somehow with, poor movement, slipping, whatever it might have been, irritated that joint. You can do something to calm it down, and then we can kind of proceed through therapy with stretching, strengthening, kind of rehabbing the tissues around it.
Yeah, and our body is pretty good about naturally defending against pain. And sometimes what I'll notice and what you notice as well is that people will make changes to the way they actively do things to reduce the pain that they may get from it. So they'll walk a little bit different way or walk with a limp. They won't fully straighten things out. Maybe they'll change the way they lift their arm just to reduce the arthritis of their shoulder, or, change the way they're moving their back to reduce that. And those changes can always cause pressure on the tissues and changes to those tissues. And then that can cause acute inflammatory symptoms. And so I think, like you said, from your perspective, some of those chronic changes can potentially be corrected, but a lot of people don't notice that they're doing them. And that's where a functional evaluation in the clinic can be helpful from your standpoint, right?
Yeah, it kind of works as a cycle. You know, you have pain, so you tighten up, you move less, hurts more, gets stiffer. You tighten up, you move less, hurts more. So then you just compound upon itself with time. So you lose range of motion in that joint. The muscles around it tighten up, so they're not as elastic for movement. Classic case you see kind of an older person out golfing. Their swing's about there.
Correct.
Just because those joints aren't moving as well, the muscles tighten. So you have to kind of work on stretching those muscles back out, getting some of that joint mobility back, try to lengthen that movement back out.
Yeah, because that person maybe is not getting as much motion during their golf swing or during their activity. And so then they try to produce more force to be able to hit it as hard. And that muscle's not set up for producing that more force. And that just kind of causes this kinetic chain reaction. And so I think all these things are important to think about when we're talking about joint pain and arthritis in multiple joints. And so I think the take-home message, at least from my standpoint, is number one, movement's the key. Arthritis.
Motion's lotion.
Motion's lotion, exactly. I'm going to steal that
I knew
one.
you could say.
I'm definitely going to steal that one. So I think movement's the key. Heat is definitely, I think, quite helpful. And a low-impact exercise program, I think, is helpful. And yes, initially, that low-impact exercise program may cause some discomfort as that joint is becoming acclimated to some of those activities. And I think that's another thing to maybe touch on briefly is we're at the beginning of the year, everybody's picking up their exercise regime to be able to lose weight and kind of meet their fitness goals. But your joints need acclimation to specific exercise or specific activities. You can't go out and run 3 miles after not running for 3 months. You're going to have pain in the joint with that. Your joint needs to accommodate to those type of higher level impact or loading activities. And so that's why it's important to start slow and gradually progress your way up so the joints can become more acclimated to it. I'm going to continue to use that word. And potentially help to reduce your symptoms that you may have from it.
Yeah, just like any activity, ease into it.
Yep.
Understand you're going to have some level of discomfort, not necessarily a bad thing.
Yeah.
I like to say pain 6 out of 10, sharp stabbing pain.
Yeah.
Typically, that's what we want to try to avoid or stay under. Discomfort, it is what it is. I mean, I think it's an acceptable thing to have discomfort with activity versus sharp pain medication needing pains.
Correct. So I think if you have acute inflammatory pain, come in, get checked out in the Express Care Clinic. We're happy to check you out, do some x-rays and see if arthritis is potentially an underlying condition. If you have chronic progressive symptoms, that dull aching pain that just won't go away, the pain's definitely worse at night, maybe noticing some limitations in your motion, again, come in and get checked out. But that's where I think a visit with Darren and his therapy department would be quite helpful to help with this injury prevention. And again, try to stay active, try to be out there and exercise and keep those joints moving because motion is lotion.
Motion's lotion.
Anything else to add?
I mean, arthritis is a progressive condition, like you said. So it can progress to the point that ultimately you need to go in, see an ortho doc, get a joint replacement, be it a ankle, knee, hip, shoulder, whatever it is. Sometimes it's just inevitability. But coming to PT before it helped stretch out the muscles, build some strength ahead of time, helps that recovery also. So if you are going in for a joint replacement, just get an exercise routine to kind of build up to that, starting maybe month, 2 months ahead of time, just to build some strength. It's going to help you in the recovery long term after having that surgery also.
Correct. And regarding the how do I prevent the arthritis from progressing, unfortunately, as you said, that's not something we can necessarily prevent. We do know that weight plays a cause into it. So the increased load across that joint, especially with the weight-bearing joints, can increase the risk or the progression of arthritis. Some higher impact activities can increase that progression as well. And the dynamic stabilization, the strength around that joint can reduce the progression and potentially have that joint last longer. So I think all those things are important to keep into consideration. I think that's it, right?
Yeah.
We appreciate you guys listening to the Motion Lab podcast. I think this was a good episode. Again, please feel free to reach out in any of the comments regarding any episodes or things you'd like us to talk about in the future.
Yeah, drop us a line if you have any comments, questions. We'll do our best to answer them.
Thanks again. We'll talk soon.
Thanks.